I have the pleasure of presenting the proclamation that October 2022 is Breast Cancer Awareness Month. And I want to thank Commissioner Myers for the last two awards and recognitions, because those were as critical as the success of this effort as well. I'd like to ask the following guests to join us. Dr. Avan Armagajani to join me, along with Dr. Bobby McKee, and from Planned Parenthood of Southwest and Central Florida, Dr. Robin, I'm going to mess this up, Schickler, is that correct? Our Chief Medical Officer for Planned Parenthood, and Kate Thompson, hi, Director of Government Relations and Community Engagement, also from Planned Parenthood. Welcome. Thank you very much for joining us. And it's important that we recognize that each year, breast cancer affects well over 200,000 people in the United States. The good news is the disease is curable, thanks to dedicated medical professionals, researchers, and numerous others. Early detection and intervention is key. New treatments and therapy, regular breast exams, mammograms that have resulted in reducing breast cancer death rates over the last 30 years. Numerous local organizations are instrumental in providing the best resources for breast cancer detection and treatment. In fact, yesterday and today, Hillsborough County is hosting the Advent Health 3D mammogram bus right here outside of County Center for the benefit of our employees, because we recognize how important it is that early detection is possible. And our employees are so busy, sometimes they don't have a chance to go out to get one. I am guilty of that. In honor of these life-saving events, the Board of County Commission recognizes October as Breast Cancer Awareness Month every year, and I'm very proud to offer this proclamation. I'm going to ask, if you don't mind, holding these up so they can see them, and we'll put them on the screen. Okay, it reads, whereas according to the Susan G. Komen organization, an estimated 287,850 women in the United States will be diagnosed with invasive breast cancer in 2022, with 43,250 losing their lives. And whereas in 2022, more than 2,700 men will be diagnosed with invasive breast cancer in the U.S., and approximately 530 of them will lose their battle. And whereas, according to the Florida Department of Health, Hillsborough County has the 19th highest annual incident rate of breast cancer among women in the 67 counties in 2019. And whereas researchers across the world are continuing to develop new imaging tests, treatments, and other procedures to find better ways to prevent, detect, and treat breast cancer and improve the quality of life of patients and their survivors. And whereas since 1990, death rates from breast cancer have been declining, in part due to the improved screening and early detection, increased awareness, and improved treatment options such as surgery, radiation, hormone therapy, chemotherapy, and targeted therapies. And whereas, according to the American Cancer Society, when breast cancer is detected early and is localized and in the localized stage, the 5-year survival rate is 99%. And whereas, in observation of Breast Cancer Awareness Month, Hillsborough County partners with area healthcare providers, such as those here today, it doesn't say that, but such as those here today, to provide mammogram exams in ongoing effort to enhance early detection, increase the quality of life, and raise awareness of breast cancer throughout the county. Now therefore be it proclaimed that the Board of County Commission of Hillsborough County, Florida, does hereby declare October 2022 as Breast Cancer Awareness Month in Hillsborough County and urges all women and men to be screened for this disease and encourages everyone to learn more about breast cancer risk factors during the month of October, executed the 6th day of October 2022. And with that, I'd like to welcome Dr. Armangi, is that right? That's right? Did I say that correctly? I'm sorry. I'm going to make it messed up. I apologize. I knew when I said it the first time the wrong way, it was going to stick with me. I apologize. But I'd love to introduce you and ask you to say a few words.
Thank you so much, Chair Overman, and thank you to the entire County Commission for this recognition. I am a breast medical oncologist at Moffitt Cancer Center, so I treat both men and women with breast cancer. As Chair Overman had spoken already, breast cancer is the most common cancer in women in the United States, and it is the second leading cause of cancer death, just behind lung cancer in women. That's why October, and really every month, is an opportunity to raise awareness on prevention, early detection, and treatment of breast cancer. Over the last few decades, there have been incredible scientific breakthroughs that have really revolutionized how we diagnose and treat breast cancer. And we've also been making significant strides to identify barriers and improve access to quality cancer care. So thank you again for this wonderful opportunity and this amazing recognition. And I would like to leave you all with this one last thing: mammograms save lives. We know that. So I urge you all to get your screening mammogram every year, starting at the age of 40, and also to encourage your mom, your sister, your friends, your coworkers, because I truly believe that together we can win this fight. Thank you.
Thank you very, very much. As a past patient of cancer, Moffitt Cancer Center, to determine whether or not I was experiencing breast cancer, I am so thankful for the resources that you have. My mom's a survivor because of the early intervention, and so I'm very, very happy that you're in our community. I'm also very happy that we have Planned Parenthood with us represented, that oftentimes offers access to mammograms that are not otherwise available. And so with that, I'd like to ask Dr. McKee to come offer us some thoughts.
Thank you, Commissioner Overman, and thank you, County Commissioners. It is my honor to accept this plaque on behalf of Planned Parenthood of Southwest and Central Florida, and more importantly, on behalf of our hardworking staff and our Tampa centers that serve our Hillsborough County communities. As been discussed, more than 287,000 cases of invasive breast cancer will be diagnosed in the U.S. alone this year. As an OBGYN, I'd be remiss not to use this platform to discuss breast cancer risk factors and screening recommendations. Anyone with breasts should be having a clinical breast exam by a provider every 1 to 3 years, starting at the age of 25, and every year starting at the age of 40, as well as a mammogram starting at the age of 40 every 1 to 2 years. People should talk to their doctor if they or a family member has been diagnosed with breast or ovarian cancer, because they may be at higher risk and may need more regular screening. Our mission at Planned Parenthood is to deliver care no matter what. With or without insurance, patients can always find high-quality health care at our Planned Parenthood affiliate. This includes cancer screenings, breast health and mammogram referrals, annual wellness exams, and more. Thank you again, Commissioner Overman and County Commissioners, for recognizing our incredible health center. And thank you, Moffitt Cancer Center, for the work that you do in our community. It is an honor to receive this plaque at this time. Thank you.
Thank you. Thank you very much. Dr. Schischler? Sorry. Dr. Schischler. I'm sorry. I thought I said McKee. Okay, it is. Dr. McKee?
The Moffitt.
Moffitt, right, did that. Sorry. It's been a long couple of weeks, I would say. My apologies. Yeah. And Director Thompson?
Oh,
Dr. Schickler said everything.
She said
we wanted to
everything.
say.
Okay. Well, great. I want to thank you all for being here and helping us celebrate a very important awareness that we need to do that will actually save lives. And so we can step back and take some photos. Come on back.